Hello, my name is Brenda Barker, and I'm here today to present to you my transcultural nursing presentation. The purpose of this presentation is to increase cultural competence that will result in provision of safe, quality care to clients of the Muslim culture. Cultural attributes such as beliefs and values related to healthcare will be discussed and how the culture as a whole defines health. How to provide culturally sensitive nursing care across the lifespan of the Muslim culture will also be included. The Arab Muslim population is a dramatically increasing minority in the United States. Now to talk a little bit about their cultural attributes. In general, the term that's used, Muslim culture, it's used broadly to represent many diverse Muslim cultural groups, such as the Asian Muslims, the Middle Eastern, the African, the European, and the American Muslims. Each group has their own variations on customs and traditions. Some may be more motivated by culture than by religion, but nonetheless, some aspects of their religion or culture are accepted by all Muslims. Their definition of health, Muslims believe that God created human beings and gave them their bodies as gifts to be cared for. On the day of judgment, God will ask what they did with their bodies and their health. As far as their health beliefs and values related to health care, modesty is extremely important within this culture. The Islamic religion does not allow the use of healthcare professionals of the opposite gender unless it's impossible to locate one of the same. Some Muslims might not participate in health promotion activities because they do not believe they can prevent something from happening if God has preordained it for them. The husband has to give his approval before the wife can sign a consent form for a tubal ligation or a hysterectomy. When a member of the family is newly diagnosed with a medical condition, family members must be present. In some cases, especially with cancer and other serious diseases, the patient will not be told of his or her diagnosis. Instead, the healthcare provider should inform one of the family members, and then one of the family members will decide to tell the patient or not. This is actually done, they believe this protects the patient. Abortion is prohibited as well. The exception to this rule is when the mother's life is threatened and an abortion is then necessary. Islam does allow organ transplantation, but only in the case of saving the patient's life. Muslims do like to pray a lot. They pray 5 times a day. Many Muslims try to strengthen their relationship with Allah, who is their God, during illness, believing that this might contribute to their cure or healing, increasing their commitment to religious practices. As far as nursing care across the lifespan, we will begin with the childbearing women and their families. Muslim women are often portrayed as inferior beings and participate in the segregation of the sexes, which is a practice encouraged by Islam. The family unit is regarded as a cornerstone of a healthy and balanced society. Marriage forms the sole basis for sexual relations and parenthood, and within the marriage, the man is the head of the household. Islamic law generally discourages the use of contraception, therefore, the traditional Muslim family is extended. Children 0 to 17 years of age. Female genital tract mutilation is a practice that is carried out in many regions of the world, but is very common in some Muslim countries. The procedure has different forms and is typically done at the age 6 or 7. Several issues that are normally discussed with American teens cannot be discussed with the Arab Muslim teens. These include things such as safe sex and family planning. No sexual relations are accepted before marriage. Even discussing physical changes during puberty should be put into an Islamic context. Adults ages 18 to 64. Celibacy and sex outside of marriage are strongly discouraged because they are considered behavioral extremes that are not conducive to a wholesome society. Marriage is considered the union of 2 families, and the parents usually arrange the marriage. Consanguinity intermarriage is particularly common in Muslims. Current estimates are that some 75% of couples are in a consanguineous relationship, and approximately 50% are married to first cousins. Older adults 65 plus. Elderly parents are respected on account of their life experiences and their hierarchy position within the family unit. The opportunity to attend the needs of one's parents in their later years is viewed as a gift from Allah. I found this when I was searching for images, and I had to include it because I thought it fits in perfectly with the previous slide. Is how do Muslims treat the elderly? Your Lord has commanded that you worship none but Him, and that you be kind to your parents. If one of them or both of them reach old age with you, do not say to them a word of disrespect or scold them, but say a generous word to them, and act humbly to them in mercy, and say, My Lord, have mercy on them, since they cared for me when I was small. I think we should incorporate that in our culture as well. And as far as the communities, communities within this population face many barriers to accessing the American healthcare system. Some barriers, such as gender preference, modesty, and illness, causation, misconceptions, arise out of their cultural beliefs and practices. This makes Arab Muslims in the United States at increased risk for several diseases, such as heart disease, cancer, and diabetes. They lack the knowledge that is needed to prevent, detect, and treat these diseases. So you should have more knowledge now about the Muslim culture and the Islamic religion after its presentation. Different cultural beliefs and values were discussed, as well as how this population views health. Various differences are present across the lifespan that are much different than many other cultures. Nurses need to be knowledgeable of these religious and cultural factors to be able to provide culturally competent health and health promotion services for this population. Thank you very much for your time.